We're joined now by Simon Harrison from Ideas Afresh. Simon, thanks very much indeed. We really appreciate the fact that you've decided to join in this discussion. But first of all, for all those people looking in, who is Simon Harrison and what's his experience?
Okay, well, I'm Simon. I'm director of Ideas Afresh, which is my own consultancy. I'm a nurse by background many moons ago, had a career in the NHS, did a master's degree in change management, moved out to work for some of the big private hospital providers, Bupa and BMI. And for the last 10 years or so, I've been working in health and social care at board level as a consultant and a professional interim.
And what's your experience then being of social care? Of course, we've been witnessing the debate about a growing older population, we've been witnessing it actually expanding. So what's your experience of how the system is matching that new demand?
I think the system is struggling. I think the system is probably creaking, actually. I think there is a north-south divide, and there is a divide between those who are paid for by the local authority and those who pay for themselves. And I think that gap is ever widening. We're an older population. People are living longer. Thank goodness we've got ways of keeping people going a lot longer. And so we keep our loved ones with us for longer. But that creates demands on society. And we have to look at how we provide that level of care, and probably need to look at some more innovative ideas of doing that, both from a commissioner point of view and from a provider point of view.
And what type of answers are you thinking about? Or maybe we draw back a bit, because you've hit the headline saying that the system isn't providing. In what way is it not there? Maybe we'll just look at that first. In what ways? I know you've said north-south and paying, but in what way is that then affecting the individual or communities?
I think in simple terms, people go into hospital. And they go into hospital when they've spent a lot of time in their own home, because policy is that we try and keep people home for as long as we possibly can. So we provide a level of home care, and that increases and increases, and there becomes a time when people then put demands on the NHS. You go into the NHS, you're providing care there, and then you're looking at what the longer term solution is. And the longer term solution might be going into a care home. It may be going back into your own home with a package of care. And I think what's happened is we've moved. So what was a residential home now is equivalent to an old nursing home. And what was an old nursing home is now equivalent to a cottage hospital. And the acuity of people coming into care is much greater. The acuity of people living at home being provided for home care is much greater. And so all those demands require people, and people is our greatest resource. And that's a major challenge. And it's going to become an even bigger challenge with Brexit, I'm sure, when it comes to recruiting and retaining people. And then it's about, what do we pay people? How do we reward people? How do we recruit people? How do we retain people? And make it a valuable vocation, a valuable job that people want to do in terms of providing long-term social care.
And, that's perhaps easy said, but as I started the conversation with, we've been aware of the debate, we've been aware of the actuality, yet we still in 2019, February of 2019, are still saying those issues are glaring and stark and not being dealt with.
I think we need a sense of purpose, a sense of direction. I mean, my vote would be to have a kind of commissioner for older people, someone who was focused, cross-party, doesn't matter what your politics are, this is an issue facing the country. And we need someone who's focused, who can pull all the agencies together. Because the reality of life is, let's face it, we've got different providers looking at this, and many do talk. Yes, they are competitors, but in terms of the challenges they face, they do talk to each other. But we've got the NHS and the local authority on a different page, because it's a different funding stream. And then we've got, means testing of people as to whether or not they can fund care themselves, or they have to have it funded. And then there's a whole lot of bureaucracy that people have to go to, probably rightly so, to ensure that, that funding is either forthcoming or it isn't. And then they have to look at, how much they've got. We're kind of, sat here chatting about this now whilst we're still able to think about it. but many people just fall headlong into care without giving it a great deal of thought.
So how do we end up with the proper result?
I mean, I think it needs a great deal of thought, but I think, you know, more and more people are coming into the market. There is a demand. That demand is not going to go away. The debate is who's going to pay for it and what does care look like. And that's why I think we need to look at some innovation. So we need to look at how we recruit and retain staff, what the staff of the future look like. You know, are nurses going to remain a scarce commodity? In which case, do we need to look at alternatives to registered nurses? And a number of providers are looking at that. Only last week, I think they were looking at how the new nurse looks, i.e. that's someone that looks different to the qualified registered nurse, what the skill set is for people to provide that level of care in a residential setting. And then also in terms of how we use technology going forwards. So, you know, we're going to have to move away from pens and paper, and that's probably not a bad thing. But, you know, we need to look at how technology can help, not necessarily provide the care, but help provide the support and the evidence that care is taking place. All of that costs money. So that clearly is a challenge for providers in terms of how do we invest in new technologies. But if we know there's a longer term plan, a longer term end game, then investing in technology it is a benefit, and therefore should be something that we can look at with an end game that says, okay, we've got a new system, we've got new systems and processes, we've got a new range of people, and then we've got new technologies that enable us to move from what has been traditional thinking to new thinking. But it's a big step change, and I come back to that. All needs thought, it needs coordination, and it does need money.
Yes, and it strikes me that the people, you know, will people act if they think that government's about to make decisions around things? So will they act on their own, or will government wait until providers maybe start becoming more efficient? And so are we kind of hovering over a starting line here? Yeah. And if that is the case, what will make them move beyond?
Yeah, no, I think you're right. I think it's who's going to make the first step. I mean, if I kind of take you to back to the north-south divide, or I take you to the self-pay first, publicly funded, a number of the, I would say, higher end providers have taken this step because they can. They're bold, but they know they can do it. They're moving into new builds, and so within the new build, they factor all of this in. Many operators are still operating in older stock. That to invest in new technologies and new ways of working is quite a challenge, because a traditional home looks in a certain way and is staffed and run in a certain way. If you build a new purpose-built care home and factor in all of that technology and probably smarter ways of working, then actually you can take that bold step at the very early stage. If you're trying to retrofit it, it's much harder.
So it strikes me that the population is growing bigger, in the sense of the older population. Government is saying we're going to reach into our pockets for some more money, but that will only fit the bigger population. It won't be an increase in spend. It will be an increase in spend, but for a bigger demand. So unless there's very radical funding thinking coming forward from government, which will go beyond just fulfilling the market or the demand, we'll end up stuck. I don't want to sound depressing, but it seems that we will end up stuck unless it is new and different thinking.
Yeah, no, absolutely. I mean, I think in my straw poll of a few MPs that I've spoken to, I get the same answer that, well, we're pouring more money into the NHS. And I said, but that wasn't my question. The NHS is getting more funding, and probably rightly so. And, you know, as a country, we're proud of our National Health Service. But I wouldn't say we're proud of our social care service. And many people, until they're actually in the system, don't understand or don't realise. And so, you know, we pay our taxes, we have the NHS provided for us free at the point of care. So we go to our GP, we go to the hospital, and all of that is provided for. Then all of a sudden, someone says, well, you need to have care, or you need to go into a care home, and that's going to cost you. You go, but if I went into hospital, it wouldn't cost me. Why does it cost me to go into a care home? And that's where I think there is a distinct lack of clarity from central government, and I don't think local government make that very clear either. And therefore, the man in the street is often confused by what it means in terms of getting old and how care is going to be provided. As I said earlier, we're chatting about it now, we're giving it some thought, but a lot of people have just fallen headlong into a system that's probably failed them. And then they suddenly have a shock that actually I've got to pay for this, and what can I afford to pay for? And sadly, then that opens up choices, just like we all have choices about how much we spend on a holiday or how much we spend on a hotel. Those choices are then faced with, where am I going to spend my days? That's a lovely home, but the local authority are only going to pay this much. If I want to stay there, I'm going to have to pay for it, or they're not going to pay for that one at all because it's too expensive. I need to look at funding that myself. So it's about planning ahead, and it's about understanding what we as a population want for the future.
And it strikes me as well that as you described that, we've got individuals who then are confronted by the issue and would probably want to avoid dealing with things that is way over the horizon somewhere. But there's also, on the provider side, different tiers of ownership. It's a fragmented ownership model. And where does the voice come from there? I know we're talking to representative organisations in Scotland and in England, and of course they represent them. But how do you drive action into the provider to make them more aware of what they can do to highlight the issues for the public, be more productive and efficient in their own processes, fully aware that it's going to take a long time for the government to turn around in their favour?
Yeah, I often use a phrase about attitude, behaviour and culture, and I think this one very much fits into culture. So providers, in terms of care homes, even it's very fragmented. So there are lots and lots of providers. Even the biggest provider, as a percentage of the whole provision of social care, is actually relatively small, although it is nevertheless a big organisation. But there's a long tail of providers, and over the years people have entered the care market for various reasons. Most people have entered it for good reason, which is to provide a level of care for individuals going forwards. But I think to pull the whole market together and have a voice is something that a number of different organisations are doing. So lots of providers belong to different bodies, and those bodies are trying to make their voices heard. There's a lot of research being done, there's a lot of think tanks, a lot of people involved in trying to get that message across. I think what it needs is for a more coordinated voice of the sector that says this is how it is. Having said that, where is the voice of the NHS? And I'm not wanting to get on a soapbox, but there's nothing less national than National Health Service, because we created NHS trusts, so they all have their own individual voice and their own individual kind of mission and vision and values. And so, if we get back to the care home providers, then everyone is trying to push themselves. In your local market, you clearly have a service. If you want to, be successful, then you need to fill your beds. Therefore, you need to make your home attractive over another home. Therefore, you've got to find what's your unique selling point, what's your USP. Why send your loved one to be cared for in our home? And it's generally not judged on price. It's generally judged on, well, it's a really good home. It's got a great reputation. The staff are great. The manager's been there for years. They don't have a lot of turnover. It's rated good with the CQC, etc., etc. There's a good feel in the local community, and therefore that's where I want my mum or my dad to go. So getting that voice and getting that kind of passion out there does take the right attitude towards the situation we're feeling. There is an issue around behaviours and very much around understanding the culture of what we are talking about in terms of care in the UK.
And then I know you've touched on a number of times about recruitment and staffing and all the rest of it. So what would make care as a career attractive? Are young people essentially looking after our older people?
Yeah, I mean, I think, if you look back, and then, people, when I entered care, I trained to be a nurse, because that's what I wanted to do. I can't really put my finger on what prompted me to want to do that many moons ago. And then why did I move into management? Well, I wanted to make a difference. If you look at what makes people go into nursing now, it's probably the same kind of drivers. But what makes people go into care, and remember, the bulk of the people who provide care in our social care system are not nurses, they are trained carers. And people go into that because it's a career choice. And some people fall into it because it's a job. And then there are a number of people who come into it because their friends or the family have come into it. But the fundamental question is, how do we get the message out there? And I think I read this week about a new government initiative about getting our young people to say, this is a good career to move into. Now, often people do move into it when they're talking about mental health and learning disability, because those sectors have found a way of making this seem an attractive proposition, making people feel, do you know what, I could really do that. I could make a difference to that young man, that young lady, etc. But elderly care for years has been something that people have not always chosen as their first career choice until they do it. And when they do it, they love it or hate it. And thankfully, we have a lot more people who love it, because it's incredibly rewarding. You move into working in a care home and working with a relatively small group of individuals. You get to know them, and you get to build a relationship, and you start to make a difference in their lives, and nothing can be more rewarding. The difficulty is when you're looking at how much you reward these people in monetary terms, as opposed to how much they would get stacking shelves in a supermarket. Frankly, there isn't always a lot of difference. Now, is it, if you look at the supermarket job, we all like to go shopping, we all like to go to the supermarket, we want the shelves to be stacked. There's nothing wrong with the job, but how do you make that job less attractive than the one in the care home? And it can't always be, well, I'm going to give you more money. So it's about, how do you make people feel rewarded as being part of that team? So the recruitment bit is not always the hardest bit. The retention bit is the hardest bit. So we will provide training. Of course, we provide training. We provide training that is statutory and mandatory to enable you to do the job. And then we'll probably provide training over and above that, which will give you a level of skill that you might not otherwise get if you chose another career. And I think then there's also that reward strategy, which isn't always monetary, but it's that reward in terms of recognition. So, being told that you're doing a great job, it's the thank you, it's the supervision and appraisal where you're constantly fed back as to how well you're doing. And then the ability to then take some additional responsibility. And then people then very much feel part of a team. Okay, I'm a carer in a care home, but actually now I'm becoming a senior carer, or I've got responsibility for X, Y, or Z, and I feel really part of this team. And I feel at the end of the day, when I go home, I've made a difference to those people I've worked with. I think that's what hopefully then wins hearts and minds and makes people go, do you know what, I've made a great career choice here.
Yes. And I'm not putting words in your mouth, but that you're talking about the value attaching to the home and the individual. But I suspect that must be a value that is from government down. The government says we value you, policymakers say we value you, and so that there's a whole value system attached to the outputs within social care as affects the elderly.
Yeah, I mean, I think what we need is a recognition that there are certain jobs in society where we people say, oh, he's great, because he's a whatever, or she's great because she's a whatever, and it has a certain standing. And then there are other jobs that people go, oh, he's only a, she's only a. And what I always say is, there's no one who's onlyer. The person in the home who's the cleaner is fundamental to the cleanliness of that home. And actually, if you want to be really clinical, then that affects, infection control. It affects, people's well-being. So actually, it's an important role, and it's a team effort. Everyone's responsible. It's a bit like saying, well, I'm not responsible for that because I'm not the quality manager. We're all responsible for quality. It's just you may have someone who's coordinating quality in terms of managing the systems, processes, policies, procedures. But actually, we're all responsible for quality, whether you're the chief executive or whether you are the cleaner, because we should all have our hearts in what we're there for. And I think for me, one of the key messages I always give to staff is, I might be the chief exec, I might be the chairman, I might be the person who's at the head of the board, but the reality is I'm an overhead, I'm a cost to the organisation. You're the important people. You're the ones who are providing that day-to-day care for the individuals that either they or the government are paying for. You're more important than I am. I'm required, but I'm not as important as you, because I might be driving the strategy, but I'm not the person who's coming in to provide that level of attention and care to the individual who's in a bedroom, or maybe at end of life. I'm not the person who's going to be holding their hand as they leave the world. You are, and that's more important than anything that I'll do today.
Yeah. So those processes, innovations, whatever, are actually all about value, but driving efficiency and effectiveness.
Absolutely.
Potentially saving.
Yeah.
In the long term. Okay. Simon Harrison, thank you very much indeed for your contribution.